Hey everybody, it's Brian, physical therapist, and today I'm going to show you the flexion and rotation lying to right and left. So this exercise can be done lying on the bed and feet kind of up in the position where we do most exercises, supine or on our back. So this exercise is good when you're stenosis, you have stiffness, or if you have, like, say if the disc is moved too far to the front of your leg and you get it more up in here. This is a nice exercise to maybe stretch it out or maybe help reduce a disc issue. But basically the exercise looks like this. So what you're going to do is you're going to bring your legs up and you're going to let them, so if I'm going to stretch my left side, okay, I'm going to rotate my legs to the right, because when I rotate to the right, that's going to open my left side. So in this position, this demonstration, I'm going to stretch the left side going to my right. Okay, so it basically is this. Bring the knees up a little bit, and you're going to just let them roll off the bed. And again, you want to make sure you're on the bed and you're supported. But basically, then with your other hand, so with your right hand, all you're going to do is you're going to either just hold this. So some people, I'm going to open my left. So say if I had a really kind of a pinchy nerve on the left side and it's kind of irritable, this is going to kind of open it up a little bit. And I can just hold this position, which is called static. And I can hold this for 3 to 5 minutes or so. And then I can carefully kind of roll back to it and just see how I feel. Okay. The other option you could do is called dynamic, and this means you're going to stretch it and release it. Okay, so same idea. I'm going to roll, bring up my knees a little bit to roughly a right angle, 90 degrees, and then I'm going to let my legs roll off to that bed. And you want them off the bed a little bit so you can push down a little bit. So my other arm is, I'm kind of anchoring the bed or the table, whatever, if you have a massage table. I'm going to anchor there, and I'm pushing my legs toward the ground perpendicular, okay? So I'm resting my head, pressure on, I get a nice stretch here, pressure off, pressure on. So I like to keep my feet on the table, but my legs hanging off, because a lot of times you gotta really pull that down to help stretch that hip or maybe reduce a derangement that is in the front of your back. Okay, so that can be done a few times a day, only in a pain-free range. If you're doing an exercise and it's shooting a pain somewhere it shouldn't, and you're having more pain, obviously you're going to stop and consult your therapist. Hey everybody, it's Brian, physical therapist, and now I'm going to show you flexion, rotation, and lying to the left. Okay, so this is going to stretch out the right side. Okay, so basically I'm on my bed again, like I did for the other side. Okay, I'm going to bring my knees up. I'm going to flex them up to about 90 degrees or whatever you're comfortable, and you're just going to let them roll over to the left. So as my legs go to the left, that's going to open the right side of my back. And I'm just hanging onto the bed with my other arm. And I can start with a static hold, which means I'm just gonna hang out here for a little bit, 3 to 5 minutes, and feel a nice stretch. So really good for the stenosis type folks or just really general stiffness. It's a great stretch. It's like self-traction. And you want your feet on the bed, but you want your knees off the bed so you can get that nice stretch. Because if your feet and your legs are on the bed, there's not a whole lot of stretch going on there. And maybe that's what somebody needs to start. It's really to your comfort level. So the other way is called dynamic. So it's the same start position. I'm going to bring my legs up, and I'm going to roll them, and I can guide them with my left hand. Okay, so I'm hanging onto the bed with my right, and now with my hands, I'm just going to push perpendicularly down to the ground on my top knee. Okay, so as I push on my right leg, that's going to stretch my right flank and open up the right side of my back. So pressure on, and I can bring it up more. Pressure on, pressure off, or pressure on, pressure off. And you can play around with the angle, okay? And you can do about 10 of those, and then you can roll yourself back to the center. And again, same principles apply. If you're getting a shooting pain down the leg or your pain's getting worse, you would obviously stop that exercise and consult your therapist.